Julia's our fourth child, and we have 3 typical children. We thought everything was normal. I had a full-term pregnancy. Everything went very well during my pregnancy. What happened is after 8 weeks, we went to our regular well visit appointment, and what we found was that her brain had stopped developing in utero. After that diagnosis, we really started seeing a gap in her development, and that's kind of where it started. Reading Pediatrics became part of the Medical Home Initiative soon after Julia was born, and they asked me to be on the Parent Advisory Board, and that's really where I started understanding what the Medical Home Initiative was all about. Since then, it's been about 15 years, and it's been such an incredible blessing to us because they helped us so much with connecting us with specialists. They help us with acquiring medical supplies. When Julia needed oxygen, they told us about medical supply companies that could provide that for us. We have occupational therapists, speech therapists, a physical therapist. We have the educational component that comes to our house. And it's just been the best placement for Julia.
She had a really good day.
Good. She had some therapies?
She did.
Okay.
I think it's important for the Medical Home Initiative and practices to engage because it's what helps us continue on as a family. We tend to think that we're alone in this and that we're the only family like this and no one else understands, but once we have that connection with our pediatrician's office, they let us know that there are community resources, there are educational resources, there's camps available to our kids, there's medical help out there. When we had issues with our insurance company, they appealed on our behalf to the insurance company. Again, I didn't have to do it on my own, they helped me. It's just an amazing opportunity that we have to be a part of it, that just to give us the support that we need to carry on and feel somewhat normal.
The Medical Home Initiative has helped my family on so many levels. It's helped Julia, it's helped my parents and my siblings and I to all be able to function and contribute back to society. We've been able to do All Kids Belong programs for school assemblies and speak to 7- and 8-year-olds about disabilities and what it means to be a sibling or a parent of a child like Julia.
So it means that now, even though she's 15, she can't walk and she can't talk and she doesn't read or write like the other children do. Can she see?
Because of the help that we receive through nurses and even just having all of our supplies provided and the insurance taken care of, it's just all the stressors that are in some ways eliminated.
We're thankful overall as a family for the Medical Home Initiative. We certainly recognize that much of what we're able to do as a family would not happen without that support.
It's made my life easier, first of all, because there's less stress. I don't feel like I'm alone. We know that there's a support system out there for us through the medical home, and that's been reassuring. I would definitely recommend that other families seek out a medical home through the pediatrician's office. It has been kind of a lifeline, I would say, to us, and I believe they would find that to be the case as well.